Sexually transmitted diseases or STDs, also known as sexually transmitted infections or STIs, are infections that can be transmitted through sexual contact. This includes vaginal, oral, and anal sex. Here are some common STDs and their details. Chlamydia is caused by bacteria and often doesn't show symptoms. It's easily treated with antibiotics, but if left untreated, it can lead to serious complications like pelvic inflammatory disease, or PID, which can cause infertility and ectopic pregnancy. Gonorrhea is also caused by bacteria and can lead to PID and infertility if untreated. Symptoms include burning during urination and discharge. It's treated with antibiotics. Syphilis is a bacterial infection that can be easily cured with antibiotics if treated early. However, if left untreated, it can cause serious health issues, including damage to the heart, blood vessels, liver, bones, joints, and skin. Hepatitis B, a viral infection that can cause liver disease. It's spread through sexual contact and sharing personal hygiene items. Treatment can help manage the condition, but there's no cure. Herpes simplex virus, or HSV, is a viral infection that causes blistery sores. There's no cure, but symptoms can be managed with medication. Human papillomavirus, commonly known as HPV, is a viral infection that can lead to cancer. Most HPV infections go away on their own, but some types can cause genital warts and cancer. Vaccination can prevent certain types of HPV. Trichomoniasis, a common STD caused by a parasite. It's easily treated with antibiotics. Genital warts. Caused by certain types of HPV, they appear as growths on the genital area and around the anus. They can be treated but may recur. Pubic lice, also known as crabs, are small parasites that attach to the skin and hair near the genitals. They're easily treated with over-the-counter medications. Scabies, caused by tiny parasites that burrow under the skin, leading to itching. It's treated with medications that kill the parasites. HIV, a viral infection that weakens the immune system and can lead to AIDS. There's no cure, but treatment can help manage the condition and prevent the progression to AIDS. Symptoms. STDs can have a range of symptoms, including no symptoms. That's why sexually transmitted infections may go unnoticed until a person has complications or a partner is diagnosed. STI symptoms might include sores or bumps on the genitals or in the oral or rectal area, painful or burning urination, discharge from the penis, unusual or odorous vaginal discharge, unusual vaginal bleeding, pain during sex, sore swollen lymph nodes, particularly in the groin but sometimes more widespread, lower abdominal pain, fever, rash over the trunk, hands or feet. Sexually transmitted infection symptoms may appear a few days after exposure, but it may take years before you have any noticeable problems, depending on what's causing the STI. Alright, let's talk about the causes of sexually transmitted infections. These infections can be caused by a few different types of organisms. First, we have bacteria. Some examples of STDs caused by bacteria include gonorrhea, syphilis, and chlamydia. Then there are parasites. Trichomoniasis is an STD that's caused by a parasite. Finally, we have viruses. STDs caused by viruses include the human papillomavirus or HPV, the herpes simplex virus, and the human immunodeficiency virus or HIV, which leads to AIDS. Risk factors. Anyone who is sexually active risks getting or spreading an STD. Factors that may increase the risk of getting a sexually transmitted infection include having unprotected sex. Vaginal or anal sex with an infected partner who isn't wearing a condom, whether it's latex or polyurethane, greatly increases the risk of getting an STD. Condoms made from natural membranes aren't recommended because they're not effective at preventing some STIs. Not using condoms properly or not using them each time also can increase risk. Oral sex may be less risky, but sexually transmitted infections can still spread if a person doesn't use a condom, whether it's latex or polyurethane, or a dental dam. That is a thin, square piece of rubber made with latex or silicone. Having sexual contact with many partners. The more people you have sexual activity with, the greater your risk. Having a history of STIs. Having one sexually transmitted infection makes it much easier for another STI to take hold. Being forced to engage in sexual activity. See a healthcare professional as soon as possible to get screening, treatment, and emotional support. Misuse of alcohol or use of recreational drugs. Substance misuse can inhibit your judgment, making you more willing to take part in risky behaviors. Injecting drugs. Sharing a needle while injecting drugs can spread many serious infections. Examples are human immunodeficiency virus, hepatitis B, and hepatitis C. Being young. People aged 15 to 24 report high levels of STIs compared to those who are older. Complications. Many people in the early stages of an STD have no symptoms. That's why screening is important to prevent complications. Possible complications of sexually transmitted infections include pelvic pain, pregnancy complications, eye inflammation, arthritis, pelvic inflammatory disease, infertility, heart disease, and certain cancers, such as HPV-associated cervical and rectal cancers. Prevention. There are many ways to avoid or lower your risk of getting an STD. Avoid sex or sexual activity. The most effective way to avoid STDs is to not have sex. Stay with one uninfected partner. Staying in a long-term relationship in which both people have sex only with each other and neither partner is infected can be one way to avoid an STD. Wait and test. Avoid vaginal and anal sex or sexual activity with new partners until you have both been tested for sexually transmitted infections. Oral sex may be less risky, but STIs can still spread if a person doesn't use a condom, whether it's latex or polyurethane or a dental dam. These barriers prevent skin-to-skin contact between the oral and genital mucous membranes. Get vaccinated. Getting vaccinated before having sex can prevent certain types of sexually transmitted infections. Vaccines are available to prevent STDs caused by human papillomavirus, hepatitis A, and hepatitis B. Use condoms and dental dams consistently and correctly. Use a new latex or polyurethane condom or dental dam for each sex act, whether oral, vaginal, or anal. Never use an oil-based lubricant, such as petroleum jelly, with a latex condom or dental dam. Also, these types of barriers give less protection for STDs involving exposed genital sores, such as HPV or herpes. Non-barrier forms of contraception, such as birth control pills or intrauterine devices, don't protect against STIs. Don't drink alcohol excessively or use illegal drugs. If you're under the influence of these substances, you're more likely to take sexual risks. Talk to your partner. Before any sexual contact, talk to your partner about practicing safer sex. Be sure you clearly agree on what activities will and won't be okay. Think about male circumcision. For men, evidence has found that circumcision can help lower the risk of getting HIV from a woman with HIV by as much as 60%. Male circumcision may also help prevent the spread of genital HPV and genital herpes. Think about using pre-exposure prophylaxis, or PrEP. The US Food and Drug Administration has approved 2 combination medicines to lower the risk of HIV infection in people who are at very high risk. The medicines are emtricitabine plus tenofovir disoproxil fumarate, known as Truvada, and emtricitabine plus tenofovir alafenamide fumarate, known as Descovy. These medicines must be taken every day, exactly as prescribed. If you find this video informative, then like and subscribe for such content. Thanks for watching.